If one muscle keeps twitching in the same spot, and you also feel weak, your brain can jump to the scariest explanation. That reaction makes sense. Twitching feels like your body is sending a warning signal, and weakness can feel like proof that something is failing. But a lot of the time, those two sensations come from everyday, fixable stressors in your nervous system and muscles. The key is separating feels alarming from is dangerous. In the next few minutes, you'll get a simple way to think about twitching, what weakness really means, and which details matter most. You'll also learn a quick self-check to tell fatigue from true loss of strength, and we'll end with clear red flags so you know when it's time to get checked sooner rather than later. The goal isn't to dismiss symptoms. It's to replace panic with a plan, so you can respond calmly and appropriately. Moving to slide 2, let's define what you're feeling, because words matter here. A twitch is usually a fasciculation, tiny, involuntary muscle fiber contractions you can sometimes see under the skin. It can happen in one spot for days because that motor unit is simply more irritable. Weakness is trickier. People often mean one of three things: tiredness, heaviness, or true loss of strength. Tiredness is low energy, like your muscles run out of fuel quickly. Heaviness is the sensation that effort feels harder than usual. True weakness is when you cannot do a movement you could do before, even when you push. That difference is huge for risk. Many scary conditions are about true, progressive loss of function, not just feeling off. So before you assume the worst, you want to label the symptom accurately. Most of the time, that alone lowers anxiety and points you toward the right next step. Moving to slide 3. Why does twitching happen at all? Muscles move when nerves send signals, and those signals are controlled by electrolytes, hydration, sleep, and stress hormones. When the system is irritated, motor units can misfire a little. That can show up as a twitch, especially in calves, eyelids, feet, or hands. Caffeine, poor sleep, dehydration, and hard exercise are classic triggers. So are anxiety and hypervigilance, because when you're scanning your body, you notice every tiny movement. Another common piece is recovery debt. Your muscles and nerves are still settling after training, long walks, or even a new desk setup. None of this means twitching is imaginary. It means twitching is a normal output of a sensitive system. Your job is to look for patterns. What makes it worse? What makes it calmer? That pattern often tells you more than the twitch itself. Moving to slide 4. The one spot part is what makes people spiral. It feels like there's a single damaged area. But local twitching often happens because that region is overloaded or sensitized. Think of a calf after extra stairs, a forearm after gripping, or a shoulder after hours at a laptop. The nerve supply to that area can become more excitable, and the muscle fibers respond with little pops. Also, once you notice a spot, you check it. Checking increases attention, and attention increases perceived intensity. That feedback loop is powerful. Another reason it stays in one place is simple anatomy. Some muscles have motor units that are easier to see, so it looks localized, even if your body is generally stressed. The helpful question is not why this exact fiber, but what is this area doing all day? Load, posture, and recovery often explain the location better than disease does. Moving to slide 5. Now, let's talk about the fear. Twitching plus weakness makes people think of serious neurologic disease. It's important to be honest. There are conditions where twitching and true weakness can appear together. But the typical story in those cases is progressive, measurable loss of function, not just a scary feeling. Benign fasciculation syndrome, for example, can cause frequent twitching and a sense of fatigue or shakiness, often tied to stress and sleep. After intense exercise, you can get twitching plus temporary performance drop because the muscle is recovering. Nerve irritation from a pinched nerve can cause twitching near the affected area and weakness in a specific movement pattern. The point is not to self-diagnose. The point is to understand that there are multiple common explanations, and many are manageable. Your next step is to sort your symptoms into a clearer category. Moving to slide 6. Here's a quick way to test what weakness means for you without turning it into an obsession. Pick one simple task that matches the area, like a calf raise, a grip squeeze on a towel, or lifting a light object you use daily. Compare left to right. Do it once, not 20 times. True weakness shows up as a clear mismatch or failure. You can't get the heel up, you can't extend the wrist, you drop the object. Fatigue shows up as both sides feeling harder, or you can do it but it feels unpleasant. Also check coordination. Can you walk normally? Use stairs? Type? Button the shirt? Function is the headline. If you're still doing normal tasks, that's reassuring. If you're failing tasks you could do last week, that's worth medical evaluation. Keep it simple and write down what you notice. Moving to slide 7. A huge driver of twitching is nervous system arousal. When you're stressed, your body runs hotter. Adrenaline rises, breathing gets shallower, and muscles stay slightly primed. That primed state makes little twitches more likely, and it also makes normal exertion feel harder, so you interpret it as weakness. There's also a sleep link. Poor sleep increases pain sensitivity, reduces recovery, and can make muscles feel heavy or shaky. Add caffeine, and you've got a perfect storm. The frustrating part is that worry itself can keep the loop going. You notice a twitch, you worry, your system ramps up, and the twitching increases. The practical move is to target arousal, not just the twitch. If you can improve sleep, reduce stimulants, and add brief downshifts, slow breathing, light walking, stretching, you often see twitching calm down over days to weeks. Moving to slide 8. Electrolytes and hydration are another common piece, and they're often misunderstood. You don't need a supplement stack to have stable nerve signaling. But if you're sweating a lot, drinking alcohol, undereating, or drinking tons of plain water without enough salt in your diet, your balance can shift. Low magnesium, low potassium, or low calcium can contribute to cramps and twitching in some people. Thyroid issues and vitamin deficiencies can also play a role, which is why persistent symptoms sometimes deserve basic labs. The practical takeaway is simple: steady fluids, regular meals, and enough protein and minerals. If you're dieting aggressively, training hard, or skipping meals, your muscles can feel weak and twitchy because they're underfueled. If you suspect a deficiency, a clinician can guide testing rather than guessing. It's about stability, not extremes. Moving to slide 9. Sometimes twitching plus weakness points to a mechanical nerve issue, not a brain or muscle disease. A pinched nerve in the neck can affect the arm and hand. A pinched nerve in the lower back can affect the calf or foot. The clues are pattern and pairing. You might notice numbness, tingling, pain that shoots, or weakness in a specific motion like lifting the foot, extending the wrist, or gripping. Symptoms may change with posture, like looking down at a phone, sitting, or sleeping position. In those cases, the one spot makes more sense, because a single nerve root supplies a specific territory. This is also where a clinician's exam is valuable, because reflexes, sensation, and strength patterns can localize the issue. The good news is that many nerve irritations improve with time and conservative care. The important part is recognizing the pattern early. Moving to slide 10. Let's get very concrete about red flags, because this is what people actually want to know. Seek medical evaluation sooner if weakness is clearly progressive or if you're losing function in daily tasks. Also take it seriously if you have trouble speaking, swallowing, breathing, or if your face droops. Sudden one-sided weakness, severe headache, or new confusion is urgent. Another red flag is new bladder or bowel control problems, especially with back pain or numbness in the groin area. Fever, unexplained weight loss, or a history of cancer changes the risk picture too. And if twitching is accompanied by significant muscle wasting, or you see a clear shrinking of a limb, that deserves assessment. Most people with benign twitching won't have these, but having a checklist helps you stop guessing. It turns fear into a decision tree. Moving to slide 11. If you don't have red flags, the next step is usually observation with structure. Give your body a calm 2-week window where you reduce obvious triggers. Prioritize sleep consistency. Dial back caffeine if you're sensitive. If you trained hard, take a deload or switch to lighter movement that keeps blood flow without overload. Hydrate steadily and eat regular meals with enough protein. Also, stop testing the twitch every hour. Checking keeps the nervous system on alert. Instead, pick one brief daily check-in. Note the twitch frequency, any cramps, and whether function changed. If symptoms are improving, that trend matters more than day-to-day fluctuations. If they're stable but annoying, that's still often okay. If they're worsening, spreading with true weakness, or adding new neurologic symptoms. That's when you escalate to a clinician for an exam and possibly labs or nerve testing. Moving to slide 12, a quick note on the medical workup, because uncertainty is stressful. A clinician will usually start with history and a focused neurologic exam. Strength, reflexes, sensation, coordination, and gait. If needed, they may order basic blood tests to look at thyroid function, electrolytes, blood counts, and vitamin levels. In some cases, they'll consider an EMG, which measures electrical activity in muscles and nerves. That test can help distinguish benign fasciculations from certain nerve disorders, but it's not automatically required for every twitch. The timeline matters too. Many benign patterns fluctuate and improve over time. The goal of evaluation is clarity, not catastrophe. If you go in with good notes, what started first, what makes it worse, what tasks you can't do, you help the clinician help you, and you leave with a clearer plan than endless internet searching. Moving to slide 13. Let's wrap this up with the mental model. Twitching is often a sign of sensitivity, not damage. Weakness is only truly concerning when it's measurable, progressive, and tied to loss of function. Your job is to separate sensations from performance, and then watch the trend. If you have red flags, get evaluated promptly. If you don't, reduce triggers, calm the nervous system, and give it a little time, while tracking function in a simple way. If you want, leave a comment with a forced choice. Is your main symptom A, twitching that you can see, or B, a heavy, weak feeling without visible twitching? And if you found this framework helpful, subscribe for more clear, calm explanations of common body symptoms. This information is not a substitute for medical advice.